Tanya Ellis, and this is my informative speech about embalming. Embalming is the treatment of a deceased individual to temporarily preserve and forestall decomposition. Embalming has been a part of the American funeral system since the Civil War. Thomas Holmes, the father of modern embalming, started preserving the bodies of the fallen soldiers by using arsenic. By embalming the bodies, they were able to send them home to their families. Even though arsenic was the best thing for preserving the bodies, it was deadly to the embalmers. In 1867, the chemist August Wilhelm von Hofmann discovered formaldehyde, replacing the use of arsenic in the 20th century and becoming the foundation for modern method of embalming. Formaldehyde is a colorless, pungent gas in solution made by oxidizing methanol. Modern embalming cocktails contain a mixture of formaldehyde, ethanol, glutaraldehyde, humectants, and other wetting agents. Even though formaldehyde isn't deadly, it is still toxic, so embalmers must wear personal protection gear. Mortuary embalming is a complex process that involves many steps. The most important part is setting the body, especially the face, because after injecting the fluids, there's no moving anything. The eyes are closed, often using skin glue and or plastic, flesh-colored, oval-shaped eye caps that sit on the eye and secure the eyelid. The mouth is closed and the lower jaw is secured, either by sewing or wires. If the jaw is sewn shut, the suture strings are threaded through the lower jaw, below the gums, up and through the gum of the top front teeth, into the right or left nostril, through the septum, into the other nostril, and back into the mouth. And then the two ends of the suture string are tied together. Crazy, right? If the jaw is wired shut, a tool called a needle injector is often used to insert a piece of wire anchored to a needle into the upper and lower jaws. The wires are tied together to securely close the mouth. Once the jaw has been secured, the mouth can be manipulated into the desired arrangement. Now to the fun part, injecting the fluid. You start off with arterial embalming, where the blood is removed from the body through the veins and replaced with embalming solution into the arteries. You make a small incision right by the collarbone. Once you find the carotid artery and the jugular vein, you snip them. You inject the fluid into the artery as it is pushing the blood out through the vein. The blood flows out of the vein into the drain. Once you have finished, you close the incision, and then you must begin the cavity embalming. Cavity embalming is a small incision made near the belly button, and a sharp surgical instrument used for draining, called a trocar, is inserted into the body cavity. Using the trocar, organs in the chest cavity and abdomen are punctured and drained of gas and fluid contents, and then replaced with formaldehyde-based chemical mixture. The incision is then closed, and at this point, the body is fully embalmed. After completing the embalming process, you want to clean the body up. First, by washing their hair, comb it, and then fix it. You also want to scrub and clean the body, dry it before dressing it. After dressing the body, you want to do their makeup. And always remember, making sure that their hairstyle and makeup fit them so that they look as normal as possible. The body is then placed into the casket, and now they are ready for the funeral.